Good afternoon and welcome to United TV. I'm your host, Kemal Erkan. Today we are going to talk about very important and timely discussion that's lining up for us to discuss. As always, I'm joined by our esteemed expert, Dr. Isaias Irgau, a leading bariatric surgeon who brings a wealth of knowledge and experience to our conversation. Today, we are going to delve into a topic that has sparked significant debate and discussion across the various platforms. The recent development where Miss Alabama, which actually it turns out that she was not Miss Alabama, was awarded this person who got the Miss Alabama consent. She's at 400 pounds. And this, of course, as the morbid obesity experts and the bariatric program, this actually gets our attention a different way. The reason it is different is because we actually help our patients to go through and fight with this disease. And then when we see other things that's encouraging, in a way, misleading public and making, normalizing morbid obesity. Of course, we are going to discuss those topics, those issues in this show, and Dr. Irgau is going to help me with that. So, Dr. Irgau, how are you doing?
I'm doing great, Kemal. Glad to be back for yet another wonderful session of Bariatric Friday.
Well, good to have you back. And last week we have our support group discussions with Dr. Kelvin.
Yep.
And we'll, continue with our regular sessions. So, Dr. Irgau, we discussed the social stigma of morbid obesity in different sessions. And in some ways, in some cases, we did it in cooperation with sexual wellness, and then in some cases we shared this one with another social media personality who was, I believe she was in the, what's the guy's name now? I'm blanking. He was on his show.
Oh yes, the British guy, right?
Piers Morgan.
Piers Morgan.
Thank you. Yeah.
One is always there to support.
Yeah.
Then
Piers Morgan is not going to be happy you forgot his name. Come on.
That I'm going to leave for an airport in an hour. Now the issue comes back. This time it comes back for a different reason. And the reason is because now in one of the Miss pageants in Alabama, actually originally media actually said that she was rewarded as the Miss Alabama, but that's not the case. But before we get to that, I want you to kind of explain morbid obesity, and this is a disease, chronic disease, illness, however people understand this. It's a disease. It's not a hobby. It's not a fashion statement. It's not anything but it's a disease. So I just wanted to kind of explain to us one more time to better understand for us to see what we are dealing here.
Right. I mean, from a straightforward definition of a disease, Kemal, morbid obesity fulfills all the criteria we may want to use, right? If you take a disease like diabetes or colon cancer or an arthritis, right? We treat them as diseases because their presence in the body of a person causes harm, right? Causes suffering, but also it's life-threatening. In other words, the persistence of those conditions will lead to an early end of the person's life if those conditions are not treated, right? Morbid obesity is exactly like that. It is. So from our point of view, a person who has morbid obesity, in fact, will have much more severe consequences than many other illnesses that we treat as severe, right? Take, for instance, life expectancy. Take, for instance, the relationship of obesity with many other illnesses, right? In fact, if you were to take the leading causes of mortality in our country, right? Cardiovascular disease, metabolic diseases like diabetes, right? Cancers. All these are actually closely related to obesity. The more obesity you have, the more these illnesses you have, right? So not only it's a disease, but it's the root cause of many very serious diseases that are serious public health problems in our society right now. So from our point of view, we want to shift the conversation from blame to understanding it's a disease. We want to shift the conversation from castigating people who suffer from obesity to sympathizing with them because they are suffering from a condition. Once we shift the conversation in that fashion, we will be able to go away from a lot of the stigmatization that occurs with obesity. Now, the stigmatization of obesity is so severe, Kemal, that is also preventing people from seeking treatment. And I see this day in and day out in my 20 plus years of experience in dealing with morbidly obese patients, Kemal. I see many of them actually ashamed of coming to the surgeon, to the bariatric program, because they say, oh, I should have been able to take care of this by myself. It's all my fault. Everybody points their finger at me because I have been unable to take care of this myself, right? And the comments many of them get from their friends, from their loved ones is, oh, you're going to have bariatric surgery to lose weight? That's the easy way out, right? So really not understanding this problem as a disease, not only as a disease, but as really intractable disease, right, is leading to all this misconception, which is really extending the suffering of people who have morbid obesity. So not only society is blaming them for the morbid obesity, but they themselves are now believing they are the ones to blame, and they're not seeking treatment when they should, and therefore they are prolonging their suffering. As you very well know, Kemal, of the people who are eligible for bariatric surgery in our country, only about 1% are actually coming forth asking for this treatment. Can you imagine any other severe disease that would have this low level of penetration in the society in terms of its understanding, right? What the outrage would be, and yet we're okay when it's obesity. So definitely we want to shift the conversation about obesity, not as something that is related to appearance, convenience, looks, to something that has to do with the health of the person.
So now, for the benefit of the future discussions, so I want to just remind people that I'm not a physician. Dr. Irgau is a surgeon, so I'm a non-clinical person. So everything that I say, I have the freedom of not having a license. So Dr. Irgau is a licensed physician, therefore, of course, he's gonna focus and stay in the clinical side of this, just because that's how it needs to happen. But from the non-clinical standpoint, when we talk about chronic illness, this is a condition that persists a long time, that makes people's life more challenging, more difficult. And if you don't pay attention, things may get worse, as you explained that very well. So, for example, if we had family members, parents, grandparents, significant others who may have high blood pressure. Let's say if their blood pressure is 180 over 100, and that's been for 3 months, and then you measure them every day, and that's kind of consistent. Would you want this to be promoted, right? Would you want this to be on about they have this really bad hypertension uncontrolled, but they are beautiful? Well, they're not. They're ill. They have a problem. They have a very serious problem. And the goal is we need to actually take preventive measures to fight this problem, not to promote this problem. So that's kind of like, that needs to be set aside. This is not a lifestyle choice either. You die at the end of it. Yeah, you can make this lifestyle choice, but like, if your glucose level is not controlled, you die. If hypertension is not controlled, you won't have a long life. If the cancer is not caught early on, things are not going to be so great. And same thing with the obesity. About 5.4 million people every year die from morbid obesity. So this is a disease. So once we settle that, we need to really understand, okay, now what? Now let's make this correction. So this person, she's Miss National American Alabama. So she's part of that. Again, you know how these topics are so sensitive. So they're actually, they know that she was not Miss Alabama, but they didn't mind, media didn't mind just putting this out there as if she was Miss Alabama, and there were some corrections came. But when I look at this lady, I see a huge problem. I see a very, very young person who is probably having so many issues in her life, day to day, from the health, wellness, and other things related to that. And this person needs help, yet we are actually spotlighting her, putting it in under spotlight, and then just saying that, look, actually, this is not only it's not a problem, but let's just celebrate how beautiful she is. That's really scary. So I'm 50 years old. You're a little bit older than I am. We can process this in different ways. But a young person, I look at like 16, 17, 19-year-old teenager, how are they going to process this information when they see this? That's kind of like where we need to really actually focus and explain this from the medical perspective, Dr. Ergau. How, like, when you see this, what was your reaction?
So my reaction obviously is in a way similar to yours, meaning that when we are celebrating and elevating somebody as somebody who is going to be an example to others, we want to be very careful about what we are presenting, right? Now, if you look at the National American Miss Award, they emphasize other qualities beyond appearance as important to them in awarding that. And this young lady may well deserve that. There's no question about that. And I applaud, obviously, her efforts, right? But we have to be very careful in our promoting obesity as a beautiful thing to which people should aspire, because as you correctly said, you are promoting a disease state, right? It is very important to understand here that there are some chatters, in the internet who blame this young lady for her obesity. That is something that obviously is very important to expose, right? Because obesity is not a choice. The reason people have obesity is complex, a lot to do with their biology, with their genetics. Of course, the environment plays an important role as well, but it's not simple. It's not simple as saying, okay, this person is obese because they made XYZ choices, right? The environment has a role in it, but the genetics are really the driving factor, and it's very important to understand that. So castigating this young lady because of her obesity should not be the first reaction. First reaction should be, she should be seeking treatment, right? Because this should be seen as any other illness. But try to say, oh no, this is the way she is, and we have to celebrate it as something others should aspire to, that is really not only wrong, but it is harmful. Because as I said, Kemal, right now, obesity is probably the #1 public health problem in our society. The latest figures show that the level of obesity in the United States has reached 40%, 40. This is obesity, it's not overweight, obesity, right? Which means that the rates of diabetes, the rates of high blood pressure, the rates of sleep apnea, the rates of cancer, unless we do something to control this.
So this is a really good graph to diagram to explain how serious this problem is, Dr. Ergau.
Absolutely.
Normally, I don't share. We don't do screen sharing anymore. But this is a good one to have. This is where we were in the 90s, and then this is in the 2018 timeframe.
Absolutely.
And people with 30 plus BMI, and you don't need any explanation here.
Yep.
So
Absolutely.
this is how severe this problem is. Like 35% of the population in these countries with purple are over 30 BMI.
Yep.
And the red ones are, this unfortunately includes Delaware.
Yep. Yep.
That's 30 to 35. This is a very scary picture.
I want you to actually bring it back one more second, Kemal, because this is really a very important slide. Within the span of 3 decades, right, 1990 to the 2020s now, right? Mm-hmm. What we see is that in 1990, there was no state that is colored red, right? Not even yellow, right? In 1990, which means that there was no state.
Mississippi with 15 to
19%, right?
Only one. The rest of them under 14%.
Exactly. So there was no obesity rates, right, of 20% in 1990. Right now, if you look at the map, there is not a single state which has a blue color. This is 3 decades later, which means that all states have an obesity rate greater than 25%. Many of the states have an obesity rate between 30 to 35%, and several of them have obesity rates greater than 35%, which is 40% essentially, right? So with this level of incidence of obesity, we should all be alarmed, because the next generation, this coming generation essentially, may well have a life expectancy which is lower than the previous generation. This is for the first time, right? All throughout the last century, every generation increased its life expectancy, right? This generation may have a lower life expectancy compared to the previous generation, precisely due to obesity, because obesity is carrying with it all those deadly diseases like heart disease, stroke, high blood pressure, diabetes, and cancers, right? So with that in mind, we absolutely have to be careful about not promoting obesity in any positive shade whatsoever, in any. Now, we have to be careful not to castigate and blame people who are suffering from obesity, just like we are careful of not doing that to people who have cancer or diabetes or high blood pressure, right? Mm-hmm. We're not there to judge. We're there to take care of a problem that they have come to us, right?
Well, one thing, Dr. Ergau, and that's a really important point, and I'm sorry if I interrupted. Right now on the cable channels, and Sean, if I'm wrong, because I don't watch TV anymore, so you can correct me. You can see, like on shows like Friends, or you can see how long it has been that I'm not watching TV. But smoking is not okay on TV.
No.
Why? Why? Right? So why can we not smoke if that person is healthy? Then and then for like you have this, let's say someone is playing mafia and they don't smoke. Mm-hmm. That's bullshit. Mm-hmm. Like because that's not real. But we do it because we don't want that to be a bad example. Mm-hmm. Mm-hmm. So this is that simple.
Absolutely.
So this illness cannot be spotlighted. So, and then and I do want to make one correction. I said earlier 5.4 million, but that's 4.7 million people died in 2017. And this number increases because of these big and beautiful campaigns. So this is part of that campaign. I'm not saying that she's beautiful or not, but she is sick. Let's agree on that. So that's what we have to take care of, and then what we have to address here. This is not okay. Just like, I'll take maybe a little detour, just like in a Miss Pageant of Maryland, like not like having a transgender person being the #1, it's not also okay either. And that's my personal opinion. And I'm someone who's supporting Sarah McBride, who's a transgender. I'm on the finance committee, and I'm proud of what I'm doing with her, but I'm not okay with having a transgender Miss Maryland. So this is, like, unfortunately, they're trying to pull the obesity into that agenda. And that's why it maybe bothers me a little bit. This is not a lifestyle choices. I'm going to repeat this so many times, it doesn't matter. This is a problem. Now, I'm not saying that everyone needs to just stop their life and, be miserable with it, but no, take an action. That's why we're here. I mean, we talk about this every week. And this week, actually, we did this session with one of our patients. And you can hear from the patient perspective that this was never okay, and that she was not 400-pound little person being interviewed this week. So, and even with that, now you are telling me that if I have kids and then they are going to see this, oh, hey, I'm not going to do anything. I don't need to change anything. Because look, I can just do this, that. Then all of a sudden you have this guy. I will tell you his name in a second. Nicopoda Avocado, this is his name. He's a YouTuber. And he is about to kill himself because now he's over 300 pounds. Because what he's doing is he can show people how much he can eat. And he was a healthy guy, and now he is morbidly obese. And yes, he made some money, but you can't take that money to the other side. I mean, at least that's what they told us so far. So I do have his picture. I do want to share that so that people can connect these things. So this is, here's, when he started, here's where he was. And he's not able to, keep going what he's doing now. This is not okay. That's our fight for. This is not okay. And the other thing for part of this normalization campaign is this. And here's 1999, and from the same spot, this is 2019. This person, other than underwear issues, she has other problems. It's not the underwear, which type of underwear she's going to pick. She has issues, including cleaning herself, including, being able to fly in a regular economy seat, and then being squeezed into this one seat, and if she's not able to buy two tickets, including any conference that she attends, she's not able to sit in one seat. Then putting that person in a billboard and then promoting her disease is a very irresponsible campaign and media perspective, in my opinion.
Absolutely, absolutely. So, the key issue here again, Kemal, when it comes to education, right? Because here what we're doing is we're trying to inform people. And we're saying there is disinformation out there, right? And that is dangerous because it's not good for our health, right? When it comes to obesity, there are 3 areas of, where people really lack understanding. The first one is what causes obesity. As I said earlier on, it is a complex interaction between genetics and the environment, where choice has really very little room, right? You can do whatever you want, essentially, but if the genetics are stacked up against you, it's very hard, really, to win against them. That's one thing. The second thing that people don't understand is that obesity really is a disease process, not in any way dissimilar to many other serious diseases, chronic diseases that we deal with. The third point is that it is very, very hard to treat obesity, let alone a person by themselves. Even when you have experts like myself providing bariatric surgery, it is not easy. It requires a lot of understanding of the process, right? So that is what we want to bring forth. So when we see somebody suffering from obesity, the last thing we want to talk about is what kind of person they are, what are their habits, or are they intelligent? Do they have more character? Do they have moral standing? That's not an issue at all. Those are really baggages that we have put on obesity, and we are looking at obesity from that perspective, which is completely wrong. It has nothing to do with the person's intelligence. It has nothing to do with the person's character. It has nothing to do with the person's moral standing. It has everything to do with the biology that that person has been given by nature. I mean, it was not their choice to have that genetics, right? They were born with those genes. Those genes in this environment, and it's important to emphasize the environment, because you cannot live in isolation. You're part of the environment where you are. You live in America, you will be sitting on a chair for most of the day. You live in America, you are exposed to high-calorie, cheap foods most of the time, right? So this is the environment. Thus are the genetics we're being brought, and the result is obesity. So understanding this as a public health problem, as a disease, will help us really deal with it. First of all, in trying to minimize the impact of the environment on us, right? When people are struggling with obesity, they will be much more forthright in their ability to come forward and seek help rather than suffer in silence, right? And that will allow us really to treat more people. We have bariatric surgery right now, which for extreme levels of obesity, it is the best treatment and the most effective treatment we have available. We have increased the safety level of bariatric surgery to unprecedented levels, so much so that we talk about bariatric surgery in the same safety level as gallbladder surgery nowadays, where we do bariatric surgery as a day procedure where people have the surgery and go home at the same time. When we have achieved this level of safety of this wonderful tool to help people, why do we not let more people come forward and get treated rather than suffer for years and years with more and more consequences on their health, right? So that is really the conversation we want to have. And the issue we have with this designation of Miss Alabama is that the highlighting of the weight as something that people may aspire to, as something which has nothing wrong with it. It is a problem. It's a disease condition that has to be treated as such, and that is really the reason this conversation is very important today. Kemal.
And the other thing that I hope people who are watching this, they understand this from our perspective. One of our goal is that we want to also protect her.
Yeah.
Because how much insult she gets.
Yes. Yes.
And then my main anger is towards to those who are making her who are putting her under the spotlight. That's where the problem is. Because I mean, people, she may want this or not, doesn't matter. But she's getting a lot of hate messages, the body shaming and insults, and that's not good for anyone. But also, it cannot be so good for people who are having these issues.
Yes.
And even if they are not the subject, when they read those comments, that's not good for them either. So I think organizations needs to be more responsible.
Yeah.
They need to follow certain guidelines, just like we wouldn't want anorexia being promoted either. So if
Yeah.
someone is anorexic, that's as bad as being morbidly obese.
Yeah.
It may
Yep.
be even more dangerous because
Yeah.
they may actually die quicker.
Yep.
So
Absolutely.
this is not just one or the other. This is altogether. So if it's
Yep.
unhealthy, we may have family members, we may have personal experiences with these, but it's a disease. So
Yep.
because it's a disease, it cannot be, it shouldn't be targeted by others. In order for that to happen, these organizations shouldn't make them a target. I feel sorry for them.
Yeah.
So but someone is giving her that. I mean, what's the point?
Yeah.
I mean, this is almost like making fun of her.
Yeah. No, absolutely.
And that's not okay. That's what we are trying to also do. Like we want to protect our patient base, number one, but also people out there who are dealing with this problem. We want to also support them, and this is definitely not supporting.
Yeah, absolutely.
So, Dr. I know we may have other stuff related to this, but I have a flight at 7:30.
I know.
And I'm not fully ready yet. So the flight actually not from Philadelphia, it's from JFK, so I have to leave soon.
Yeah. And I want you to drive safely and arrive there in time. So
if it was you, you would be in the airport by now.
By now, oh, no question.
So, but this was, I think, we did cover this in a good way. So then I think our message is pretty clear. And we can bring up this, if there's any recent development, we can bring this up again. But I think this was about it for now. Again, thank you for joining us, Dr. Erkan. Thank you for your time. And
Thank you.
we'll be back with other events soon. Thank you. Bye.
Thank you. Bye-bye.